Hello, my name is Kenley, and for my research topic, I did depression. And depression is a mental health disorder characterized by persistently depressed mood or loss of interest in activities causing significant impairment in daily life. And so there are many different types of depression, such as clinical depression, persistent depressive disorder, bipolar disorder 2, and postpartum depression. But the main depression that I talked about throughout my research paper is clinical or major depression. And so, first, we're going to talk about a few of the symptoms that clinical depression has. And clinical depression, the main symptoms are loss of interest in like daily activities, loss of appetite, and just if somebody has, or you can never know if somebody has it from just you. You need to be diagnosed by a doctor, but some cues to know or and understand if a loved one of yours might have clinical depression is if it's harder for them to get motivated to do just daily activities, especially if they're activities that they used to enjoy, um, or loss of appetite, just loss of motivation in general. And that's one of the main signs and symptoms of clinical depression, and that's also an onset sign. So you can see that symptom that they have, and they might not have clinical depression quite yet, but it is an early onset sign, so it's something to look out for. Um, it's also important to note that just because somebody has a harder time doing daily activities that they enjoy, and maybe they do just lay in bed all day, because of that, as a result of that, it's important to note that just because somebody does something with clinical depression, does something like that, that just because somebody else who can go to work every single day or do their daily tasks doesn't mean that one person's more or less depressed than the other just because one shows it more or less than the other. Because you could have the same diagnosis as somebody else, but you show it completely differently. So it's very important to know and understand that, because you don't want to belittle anybody's feelings. And it just really doesn't make it any more or less depressed depending on the symptoms that you show. So clinical depression is very common. The United States sees about 3 million cases a year, and you have to be diagnosed by a doctor. And so how you go about this is usually at your like yearly physicals or something. Doctors will have conversations with you and things to see if you're showing any symptoms or signs of things like anxiety or depression. After having conversation with you, they might to see and understand, and they could give you a test which will let you know if you have that. But it's also important to know that it's not just a mental thing. So you have mental symptoms, but you can also have physical symptoms too, as well as gaining or losing weight, hair loss, things like that. So that's important to look for too, but you don't always show physical symptoms, which is why sometimes it's not caught. So after you are diagnosed, some treatment is you can go to a talking therapist, so you talk about whatever you want to talk about, and you can also go on medication such as antidepressants and things like that. It's also important to note that depression, anxiety do oftentimes get diagnosed together and are interlinked between the two. But just because you have depression doesn't mean you have anxiety, and just because you have anxiety does not mean that you have depression. It's just very commonly diagnosed together, and they're associated together a lot. So yes, that was my research paper in a nutshell.